What's up, guys? In today's video, we're going to cover 50 high-yield rapid review questions for cardiology didactic year exam. These are the questions that I studied during my PA school, and they significantly helped me improve my scores and reduce test taking anxiety and allowed me to spend more time with my family. So let's begin. Question number 1. Treatment for prince-metal angina. So when it comes to treatment of prince-metal angina, that would be calcium channel blocker, nifedipine. And I remember this, and I would encourage you guys to create little mnemonics, create little stories to help you retain information better. So I would always associate calcium with milk in my head, and in this case, I would say Prince had a smooth voice like milk. He's such a great performer, such a great musician. So anytime I think of Prince, I would think of milk, and I would immediately look for a calcium channel blocker and an answer. And that, in this case, is nifedipine. Question number 2. 4 patient groups that will benefit from statins. That is clinical ACVD, LDL greater than 190, diabetic patient with a LDL 70 to 189, and a LDL 70 to 189, and a 10-year ACCVD's risk score of greater than 75. So they can give you a stem with one of these in patient's history, and you would be like, okay, this patient can benefit from a statin, or they can ask you which one of these is a benefit to the patient in case you want to prescribe statin. So any one of these 4, if there's a clinical ACCVD, if there's LDL greater than 190, diabetic patients with the LDL from 70 to 190, and 4 LDL 70 to 190 with a 10-year risk score greater than 75. What kind of murmur is aortic regurgitation? Aortic regurgitation is diastolic discrescendo blowing at the left upper sternal border. So with the blowing murmurs, always think regurgitation, aortic or mitral. And then the next thing you want to ask yourself, where is it heard at? If it's a left upper sternal border, that is aortic. So aortic regurgitation, blowing murmur, left upper sternal border. I also made a separate video with all of the murmurs in it, so do check that out. It will cover your murmur section real good. And yeah, just keep going. Here we go. Mitral stenosis is what kind of a murmur? So diastolic rumble, best heard at the apex. So with the rumble murmurs, I think stenosis, either mitral or aortic. Next again, where's it heard at? If it's a right upper sternal border, is aortic, and if it's at the apex, that is mitral. Aortic stenosis presentation triad. So when it comes to aortic stenosis, they'll present with the ASH, ASH, angina, syncope, and a heart failure. So in a STEM, if they talk about patient that has angina and a history of the heart failure, currently presenting with a syncope, the most common cause will likely be aortic stenosis. Aortic stenosis presentation triad, ASH. This video will be helpful for you guys to listen to before your exam. You can listen to in your car while you're driving to the school. Just kind of get that repetitive motion of the high yield information. So I organized all of these questions in a book. It's PA Study Buddy for the didactic year. Covers high yield information for every class of the didactic year. You can scan this code to look for a book on Amazon. It's only $20, and I would greatly appreciate it, guys, if you leave a comment, hit that like button, and subscribe to the channel. It significantly helps with the algorithm and helps to spread the word, and I'll truly appreciate it. Here we go, guys. What is the most common cause of the mitral stenosis? So the most common cause of mitral stenosis is rheumatic heart disease. So you will find in a didactic year and later in your clinical year for your EOR exams, when it comes to the questions, I made a video on test taking strategies that will significantly help you reduce your test taking anxiety, help you save time, not feel pressed. You will find that always what they ask for is what's the most common, what's the next best step, what's the side effects of medications, mechanisms of action, and so forth. Knowing that high yield information will set you straight. You will not be tripped by the STEM and will make your grades like significantly higher. Most common cause of mitral stenosis, rheumatic heart disease. What is the most common complaint in a mitral stenosis? So the patient with mitral stenosis will more likely complain of dyspnea. What is the most common problem with the prosthetic valves? So when it comes to prosthetic valves, you should be thinking about thrombosis. So that heart cannot spin the blood like a normal valve, so thrombosis can be caused by it. Most common dysrhythmia. A most common dysrhythmia is an A.Fib, irregular A.Fib. Most common cause of the A.Fib is coronary artery disease and hypertension. So they're going to give you a stem with a patient coming in, history of hypertension, coronary artery disease, and they're going to ask you what this can lead to, and the answer is A.Fib. What is Beck's triad? Guys, you should know your triads, you should know your syndromes, because this is so easily for test creators to make questions around triads, around syndromes. When it comes to the Beck's triad, that is JVD, decreased or muffled heart sounds, and a decreased blood pressure. So JVD, you're going to turn their head, you're going to see that bulging vein. On auscultation, there's decreased heart sounds, and they're going to have decreased blood pressure. Beck's triad. Beck's triad is seen in patients with cardiac tamponade. So cardiac tamponade, you're going to see a chest x-ray, and they're going to have that heart that looks like a bottle. So bottle heart, cardiac tamponade, Beck's triad. How to differentiate unstable angina and NSTEMI when it comes to biomarkers. So when it comes to unstable angina and NSTEMI, in unstable angina, they will have normal biomarkers, where in NSTEMI, they'll have elevated biomarkers like troponin. Stable angina treatment. To treat stable angina, we're going to prescribe them sublingual nitroglycerin. So sublingual nitroglycerin, stable angina. Worst risk factor for angina is diabetes. So you're going to give you a stem with a different patient history, and they're going to ask you of all of the following history in the patient's chart, which one is most indicative to progress to angina, and that would be diabetes. What is the most common cause of MI? And the most common cause of MI is atherosclerosis. Bradycardia plus chest pain may suggest what? So they're going to tell you the heart rate is less than 60, patient has chest pain, and they're going to ask you what is the most likely diagnosis, and that would be inferior wall MI. Inferior wall MI, bradycardia plus chest pain. Inferior wall MI will involve which vessels? So they may even skip the inferior wall MI in a question stem, and they may just tell you the patient has bradycardia and a chest pain, and they may going to ask you which blood vessel is more likely involved. They'll list 4 different vessels, and the answer is RCA. Infra is how I remember this. Infra, inf, the first 3 letters for inferior, and the RCA for the RA. So infra, I think inferior wall MI, RCA. Septal, anterior wall, indicates which vessel involvement. And when it comes to the anterior wall, it's LAD, and the way I remember this, just like in the military, great lads step up. Great lads, LAD, great lads step up, anterior. Anterior, LAD. Lateral wall indicates which vessel involvement. Lateral wall is LCX, left circumflex coronary artery. LCX for lateral wall. Great lads step anterior. Easy way to separate them, and that's how I remembered it. LBB, left bundle branch block, EKG will show what? Left bundle branch block will show M, those bunny ears, in a V6. So you can see, here we go. So with the left bundle branch block, you're going to look for, this is one M here in a V1, that's right bundle branch block, and if it's in a V6, That's a left bundle branch block. That's the easiest way to separate the left from the right bundle branch block. Look here for bunny ears. If it's in V6, that's left. If it's in a V1, that is right bundle branch block. And here we go. So right bundle branch block in a V1, and you're going to have broad and deep wave, a deep S wave in a V6. And the way I remember it, even further to separate the two, that one bunny is right. Who's right? Well, that one bunny. That one bunny was right about the whole thing. The one bunny is right. One bunny is right. We won. EKG must be read within what time frame? So they're going to give you a stem when a patient comes to the emergency room, they got the EKG obtained, and they're going to ask you what time frame this should be read, and they're going to give you different time frames, and the answer is within 10 minutes. EKG must be read within 10 minutes. Nitroglycerin should be held for a patient taking which medication? So you're going to have a stem when a patient comes in and they got unstable angina, you're thinking about doing the nitroglycerin. They're going to list different medication the patient is taking, and they're going to ask you which one of these is the cause for holding nitroglycerin, and that would be PD5 Viagra if it's taken within the last 2 days. EKG findings showing irregular rhythm. So irregular rhythm is A.Fib, and then a sawtooth pattern is 8 flutter. Most common condition accompanying pericarditis. This will be pericardial effusion. Most common place for AAA, below the renal vessels. Which criteria is used for acute rheumatic fever? For acute rheumatic fever, it's Jones. A genetic cardiomyopathy caused by mutation of the cardiac sarcomere is called what? Hypertrophic cardiomyopathy, HOCM. This will be when a young athlete drops dead on a playing field. So genetic cardiomyopathy caused by mutation of the cardiac sarcomere, HOCM. HOCM sarcomere. It is characterized by a left ventricular hypertrophy. HOCM left ventricular hypertrophy. Alright guys, so I hope you like the questions. Check out the book, hit that subscribe button, help me grow this channel, I'll truly appreciate it. 31. Patient with the HOCM are at increased risk for what? So we really kind of mentioned this. This is when a young athlete just drops on the field, so this is increased risk for sudden cardiac death. What is a DV test of choice? This will be a Doppler ultrasound. If you suspect patient have DVT, you're going to order a Doppler ultrasound. When does the troponin peak? So they're going to give you a stem, patient comes in with a chest pain, you run in biomarkers, and they're going to ask you when does the troponin peak? They're going to give you different time frames, and the answer is within 12 to 24 hours. Troponin peaks in 12 to 24 hours. When does the CKMB return to normal? Again, they're going to give you different time frames, and CKMB will return to normal within 3 or 4 days. ST depression or T-wave inversion seen on EKG should make you think of NSTEMI or UA. To figure out which one it is, look at the biomarkers again. So if it's elevated biomarkers like troponin, then you're looking at NSTEMI. And if the biomarkers are normal, you're looking at unstable angina. Narrow QRS on an EKG indicates tachycardia, heart rate greater than 100. Narrow QRS, tachycardia. A widening of the mediastinum on a chest X-ray is seen with aortic dissection. If you see widening of the mediastinum on a chest X-ray, aortic dissection. Aortic dissection presentation. This will be tearing pain, ripping pain, radiating to the back. The patient will be in a severe distress and diaphoresis. They're going to come in, severe distress, diaphoresis, and they feel like their chest is just being ripped open, and it's all of that pain is radiating to the back, aortic dissection. Which criteria is used for endocarditis? For endocarditis, we use Duke criteria. And the way I remember this, endo, like endocrine class, endo, who has the great endo class? Well, Duke. Duke University has a great endo class. Duke, endocarditis. What is the most common risk factor for coronary artery disease? A most common risk factor for coronary artery disease is diabetes. What is the most common cause of the chest pain that is not cardiac related? So in a STEM, they're going to give you a patient that comes in with the chest pain, and they're going to ask you which one of these is most common cause of this chest pain but is not cardiac related, and that would be acid reflux, GERD. So you got to rule out GERD as well if the patient has chest pain. S3 gallop should make you think of dilated left ventricle. S3 gallop, dilated left ventricle. And the way I remember this is DLV S3. DLV S3, dilated left ventricle. When it comes to the gallops, S3, DLV S3. What is the most common cause of pericarditis? And that would be viral infections. So again, you can see in a STEM, they're going to give you different choices of the causes of pericarditis, and they're going to ask you what is the most common cause, and that is viral infection. What is the most common cause of pericarditis in a post-MI patients? So you can see how the test creator can change the STEM, and they're going to give you this time a patient that just had an MI like a month ago and now presenting with pericarditis, and they're going to ask you what's the most common cause. Well, in this case, is Dressler syndrome. So Dressler syndrome post-MI. Chest pain relieved by leaning forward should make you think of what? Patient comes in, they got a chest pain, and they say, the only thing that happens if I lean forward, my pain kind of goes away, but everything else makes it worse. And that is pericarditis. Chest pain relieved by leaning forward, pericarditis. What is the most common presentation of the Prince-Metal angina? So remember, Prince has a smooth voice like milk. We're going to treat it with calcium channel blocker, and the most common presentation is the early morning chest pain. When does the Prince have the chest pain? In the morning. Question may state the use of cocaine as well. So if the patient comes in, morning chest pain reported use of cocaine, and you should be thinking Prince-Metal angina. Prince-Metal angina, use of cocaine, early morning chest pain, treated with calcium channel blockers. In the cocaine-induced MI, avoid the use of which heart medication? So now they're going to tell you a patient comes in, report a history of use of cocaine, which induced the MI, and they're going to ask you which one of these medications should be avoided in this patient, and that would be beta blockers, because beta blockers increase the risk of vasospasms. In which patient population is normal to see sinus bradycardia? So bradycardia is heart rate less than 60. They're going to tell you a patient comes in, a heart rate is like 50, but they feel fine. They have like no issues, and this is most likely an athlete. So athletes can slow their heart down. Second degree AV block most commonly occurs where? And the most commonly occurs at bundle of His. So in a STEM, they're going to give you an EKG that shows the second degree AV block, and they're going to ask you which part of the heart this is more likely to happen, and answer is bundle of His. And the way I remember this easily is I'll just say, well, that's his second block. Is that his second block? Second, his second block. Bundle of his second block. Last question, guys. Definitive treatment for A flutter. So they're going to give you a STEM. They're going to ask you not for the next best treatment, but for definitive treatment of the A flutter, and that will be a radiofrequency ablation. Alright guys, that brings us to the end of the video. You guys will do great. Keep studying, keep going great. This is a beautiful profession. You're going to love everything about being a PA, and just keep studying. Thousands and thousands of people have done this before me, so can I, period. That was my mantra. You guys will do great. Check out the book. It'll be a game changer for you. Hit that subscribe button so you don't miss any other videos. And I will see you guys in the next video. Talk to you later. Bye.